Hello, in this video, I'm going to explain sensitivity and specificity when interpreting test results. So first, we need to understand true positives, false positives, true negatives, and false negatives. So a positive test means that a test says, yes, this person has this condition. A negative test means the person is tested and the test says they do not have that condition. But just because a test comes back positive or negative doesn't necessarily mean the results are correct. So a true positive means that they tested positive and the results are correct. False positive means they tested positive and the results are incorrect. They don't actually have the condition, even if they tested positive. A true negative means that the person tested negative for that condition, and that is in fact true. And a false negative means that the person tested negative, but they do actually have the condition, but it wasn't detected by the test. Okay, so we need to understand these terms to be able to talk about specificity on the next slide here. So if we look at this little table, this is what I'm going to use as we go through the next two slides. So here on this row, we have how many tests were positive. And this, I just made these numbers up. There's no actual test I'm discussing here. So these are positive test results and then negative test results. And then of those positive and negatives, which ones were true and which ones were false. So according to these numbers that I just made up, it means that 22 of our test results were correct, whether they were positive or negative, and 7 of the test results were incorrect, whether positive or negative. So I'm going to use this as an example to help you figure out how to calculate as we go forward here. So sensitivity refers to a test's ability to detect patients who actually have the disorder. So what is the true positive rate? So interestingly, if every person who took a test got a positive result, whether they have the condition or not, then that would mean that the sensitivity is 100%, because that would mean that the test detects 100% of people who have the condition. It might be falsely identifying everyone else as also having the condition, but what sensitivity is how likely are we to detect the condition if the person has it. So if every single person tests positive, that means we're going to catch every single positive case, even if it means we get a lot of false positives. Okay, so that's what sensitivity is. So we can calculate the rate of the sensitivity, or we can calculate the true positive rate by dividing the number of true positives by the true positives plus the false negatives. So we could interpret that as how many tested positive compared to how many are actually positive, but maybe they tested falsely as negative. Okay, so in our example here, using these numbers, we would use 10, that's the number of true positives, and we would divide that by 10 plus 4, because that's the number of false negatives. So 10 divided by 14 gives us 0.71, and that's the sensitivity for that test. So we can interpret that as the test accurately finds 71% of positive cases. Okay, so if all these people get the test, 71% of the people who do have that condition will test positive. So it has nothing to do with whether we have any false positives. That's not what sensitivity looks at. It's just looking at how likely is it that if somebody does actually have a condition, how likely is it that the test is going to detect that condition? Okay, then specificity is looking at it the opposite direction. It's looking at the other way. So it's a test's ability to detect patients who do not have the disorder. So the true negative rate. So in this case, if every single person who took the test tested negative, then the specificity would be 100%, because we're saying in the event that someone does not have a condition, what is the likelihood that the test will accurately identify that they do not have the condition? So if you give this test to all these people and nobody tests positive, everybody tests negative, then it would have a specificity of 100%. So it could be wrong. There could be people who do in fact have the condition, but if every single person tests negative, then the specificity is 100% because it means that we're correctly identifying all the people who do not have it, regardless of whether we're correctly identifying the people who do have it. So this one you would calculate by dividing the true negatives by the true negatives plus the false positives. So how many people correctly were tested as being negative divided by how many people actually don't have it. So how many people tested negative and how many people tested positive, but they didn't actually have it. So in that case, for our example, we would divide 12, that's the number of true negatives, by 12 plus 3, the true negatives plus the false positives. So in that case, it would be 12 divided by 15, and that gives us 0.8. So it's saying that the test accurately detected a negative case, I should say, 80% of the time. Okay, so it's saying that if we have, so here's how many true negatives we have. Okay, so how many tested as negative out of how many people were actually negative. So it's giving us that ratio between how our test performed compared to the true answer, like the actual answer to the question of how many people do not have that condition. So if we're looking at any kind of test, and it could be an orthopedic test or a blood test or any kind of test, we can look at the sensitivity and the specificity. If we look at only one, that doesn't give us a lot of information because, again, either one could be 100%, and it doesn't mean that that test is going to be very accurate. Because if everyone who took the test is negative, then it has 100% specificity. And if everybody who took the test is positive, then it has 100% sensitivity. So that's not very meaningful. But if we look at both together, then the higher both numbers can be, the better the test. Okay, so the closer we get to 1 as the ratio, or 100% as our percentage, the closer we get to both simultaneously on the same test, the more accurate and trustworthy that test is going to be. If either sensitivity or specificity is very low, even if the other is very high, then we really need to question whether we can trust that test. And for certain disorders, we might care more about sensitivity or specificity. So like there might be certain conditions that we test for where we really care that we identify every possible person who is positive, even if it means we get some false positives. So in that case, we would care more about sensitivity. We would want that measure to be closer to 100, even if it means we have some false positives that we then have to rule out. And vice versa. There might be some conditions where we care more about correctly identifying that someone doesn't have a disorder. And in that case, we might have some false negatives, but we might care more about correctly identifying that someone doesn't have the disorder. In that case, we would prefer to have high specificity at the expense of sensitivity. All right, well, I hope that helped, and I hope you have a really great day, and thank you so much for watching this video.